A very good morning to everyone. This is Dr. Dharmesh, lecturer from the Department of Oral Medicine Radiology, presenting the e-sentence for the month of October. Topics for discussion here is faulty radiograph. Errors in improperly exposing or processing dental film can produce undesirable dental radiographs of non-diagnostic quality. These are known as faulty radiographs. We should be familiar with the common causes of faulty radiographs in order to prevent them, because film with errors can interfere with accurate interpretation and diagnosis. An unnecessary retake of radiographs lead to ex- increased radiation exposure to the patient and wastage of time and resources. These are the common causes of faulty radiographs, which include projection errors or exposure in processing errors, or errors that occur due to automatic processing of films and miscellaneous technique errors. The common projection errors are the apex of the teeth being cut off. This can occur when the film is placed too close to the teeth while using paralleling technique, or when the film is placed too coronally. Overlapping contact. This occurs when the plane of the film is not parallel to the lingual surface of the teeth, or due to incorrect horizontal angulation of the cone. Tipped occlusal plane. This can occur when the edge of the film is not placed parallel to the occlusal surface, or the patient not holding the film in position. Crown cutoff. This occurs when the film is placed too apically with not enough film covering the coronal region of the teeth. Partial image. This can occur due to the position indicating device not covering the area of interest, or when the cone is not covering the entire film that is being exposed. This can also occur due to errors during processing when the film is not immersed fully in the developing solution. Shape distortion, or it can occur due to incorrect vertical angulation. The common errors seen are foreshortening, wherein the images are shorter than the object. This occurs due to excessive vertical angulation. Elongation. This occurs due to insufficient vertical angulation, wherein the images are much longer than what. Amplification occurs when there is increased film to object distance. A distorted image occurs when the film is thin, maybe due to patient biting the image or bending the image, excessive bending during positioning of the image. Negative vertical angulation and biting technique also causes distortion. Double image on radiographs occurs when the film is accidentally exposed twice, and herringbone pattern or tire track appearance occurs when the backside of the film is placed facing the cone. Blurring. This occurs due to movement of the film patient or the X-ray tube, cervical bone or adumbration. This occurs when the horizontal beam angle is not directed through the contact area of the tooth. This can commonly be mistaken for cervical caries or root caries. Exposure and processing errors. Light radiograph. This can occur due to development or exposure errors. The common development errors include the developer temperature too low, the time is too short, or the depleted developer solution, or diluted or contaminated developer. During exposure, insufficient milliampere, insufficient voltage, or insufficient time can produce light radiograph. Dark radiographs can occur due to overdevelopment, inadequate fixation, the development concentration being too high, or the developer temperature being too high. During exposure, excessive milliampere, kilovoltage, or excessive time can produce a dark radiograph. Clear radiograph. This can occur when the film is not exposed, or when the film is placed in the fixer first before development. Black radiograph. This can occur when the film is exposed to light or overdevelopment of the film. Black spots in the radiograph. This can occur due to contamination with dust or splashing with developer, film in contact with tank or another film during processing. Black lines or streaks on the radiograph. This can occur due to static electricity or film freezing. White spots in the radiograph. This can occur due to contamination with the fixer before the film is placed in the developer. Film fog. This can occur due to inappropriate safe light, high developer temperature, or using films that are outdated. Streaks on the radiographs can occur when the developer solution is failed to agitate during developing, excessive drying of the film, or insufficient fixation. Emulsion peel. This can occur due to excessive washing or physical damage to the film after this process. Yellow-brown stains can occur due to exposed developer, depleted fixer, or insufficient rinsing of films after processing. Fixer cutoff is and developer cutoff is when the film is not sufficiently immersed in the fixer or developer. Black lines can occur in the radiograph. This can be due to excessive bending of the film prior to placement in the patient's mouth. Writing lines or small white lines that are seen in the film. This can occur due to writing on the film jacket with a ballpoint pen or lead pencil. Fingernail artifact. This can occur due to rough handling of the film during processing. Miscellaneous errors, cholangioma. This is occurs when the patient inadvertently places the rest of a finger in front of the film. Smudge of fingerprint occurs when the film is touched by fingers contaminated with developer or fixer. Automatic processing errors include scratches on the film surface. This can occur due to foreign materials on the roller or excessive roller pressure and improper handling of. Okay.